Hello everyone, I am Lakshmipra Nair and I welcome each one of you to the second season of Indian Stents Get Updated, brought to you by Express Healthcare. The techniques used in interventional cardiology are becoming increasingly complex. So, is the Indian medical devices sector ready to tackle these complexities? What is the role of studies and trials like Talent RCT in furthering decision making which is evidence based? To share his insights on these topics and more, today we have Dr. P Mangalanandan from Cosmopolitan Hospital, Thiruvananthapuram with us. Welcome Dr. Mangalanandan. We are very glad to have you with us today. So doctor, to begin with, we see that a lot of younger patients in India are falling prey to CVDs. The incidence is also on the rise. So is there a reason for this? Are we more genetically predisposed to it?
There are several reasons for that. The first thing is the coronary risk factors like diabetes, hypertension, and smoking is much rampant in India, and that too in younger population. So it is quite natural that our people will get coronary artery disease much earlier than their counterparts in elsewhere. There is one more reason. You know that our country is rapidly urbanizing. This will add to for increased detection. And lastly, you know that the availability of cardiologists, specialists, and specialized cardiac care centers with advanced diagnostic and treatment facilities like cath labs are also coming up in each and everywhere. And this will lead on to an increased detection of cases much earlier. So this is not a simple thing. This is due to all these factors.
Okay. So how is actually cardiac care in our country? Is it at par with our Western countries?
See, the cardiac care in India is at par or even better than the developed countries. If you look into the topmost cardiologists across the world, many of them are Indians or Indian born. And the cardiac care that is available in India is again at par with what is available across the world, and many people are coming to India, and India is a hot destination for medical tourism.
Okay. So you are an interventional cardiologist, you have done a lot of radial and femoral procedures.
Yes.
So tell us how interventional cardiology has improved over these years.
See, interventional cardiology is a byproduct of not only medical science, but of advancement in every other field of the science as well as technology. The advantage of modern medicine is that it takes inputs from every other field of science. So the advancement in material science, design, computer-aided design, these are all have contributed to the development of cardiac devices. For example, when the coronary stents, the little metallic scaffolds that we put into the coronary arteries to keep it patent, when it was introduced, the thickness of the struts were very large when compared to today's standards, more than 100 or 120 micron thickness. But you know that now in India, we have thin struts stents as low as 60 microns available. So that way, the cardiology or the cardiac products has benefited a lot from the development in other field of science, and probably the largest intaker is the field of cardiology.
Right. So how can we bring in more personalization and precision to interventional cardiology? And what role can stents do in it?
See, just as I have said, the medical science is an evolving science, and it takes data from science as well as carefully conducted clinical trials. We are evolving our method of treatment and strategies on a day-by-day basis. How we can improve this is that we keep on improvising ourselves. For example, if you look into the stent scenario in India, the stent that is being manufactured in India is getting better and better day by day. They are improvising upon the stent design by year and year. That is why if you look really compared to the products that is available outside or that is coming from elsewhere in the world, our products are in comparison, or even I will say a little bit better than them. I am confident to say that.
Have randomized trials like talent trials helped you making in these decisions in going for Indian stents?
Exactly. See, in clinical practice, you need evidence. So we all practice evidence-based medicine. So the results of the talent trial gives us the much needed confidence to put in the Indian stents. I know that many of my colleagues who wanted to use Indian stents or Indian made stents were reluctant to use that because there were no good quality randomized controlled trials. So the talent trial has given them that evidence, so they can ethically and confidently use our Indian made stents.
Right. So how are advancements in stent technology going to change cardiac care in future?
See, stent technology, as I said earlier, is evolving. We had disappearing stents or dissolvable stents, but due to some long-term data problem, these were withdrawn from the market. But we know that such kind of stents are being designed and is being evaluated, and in the future these things may come back again. But again, our industry is experimenting with newer stent materials, designs, and with the use of these kind of things, I am very well sure that as the years goes up, we will get much better and safer stents.
What's your message for fellow cardiologists?
I would ask my colleagues to practice evidence-based ethical medicine, and if appropriate, use our own homegrown technology, because in the long term, we have to support ourselves and our own industry and our own people, because this is what is going to last forever.
Right. Thanks a lot for joining us on this platform, Dr. Mangalanandan. We are very grateful to have you here.
Thank you.
Thank you so
Thank you,
much.
Lakshmi.
So that was Dr. Mangalanandan joining us on Indian Stents Get Updated. Tune in to Express Healthcare's website for more such insightful sessions.